The gastrointestinal system. Mucus, hydrochloric acid, intrinsic factor, pepsinogen, and gastrin are secreted into the stomach from the cells within its walls and are mixed into the food to break it down further into particles for absorption. This mixture of partially digested semi-liquid food is called chyme. The small intestine receives the chyme from the stomach. It adds more digestive enzymes and fluids, receives bile and pancreatic enzymes from the common duct, and further digests the chyme into a more liquid state. The large intestine reabsorbs water and electrolytes, formulates some vitamin K, and eliminates the waste products. The internal anal sphincter at the top of the anal canal is under involuntary control, while the external sphincter at the end of the anal canal is under voluntary control. The excessive stimulation of digestive acid and enzymes can cause a breakdown in the integrity of the mucous membrane lining of the digestive tract. With advanced age, muscles used for swallowing may become weaker and less coordinated, and food particles are retained in the cheek pouches or the pharynx. The esophageal sphincter becomes less efficient at the opening and closing, and the risk for aspiration increases. The taste buds atrophy, causing an inability to distinguish between flavors, particularly between salty and sweet. After age 70, the parietal cells in the stomach decrease their secretion of hydrochloric acid. Enzyme and intrinsic factor secretion also decrease. The lack of intrinsic factor may cause pernicious anemia. The mucosa of the small intestine becomes less absorptive, and the large intestine may develop diminished motility. The gallbladder stores bile that is produced in the liver and delivers it as needed to the small intestine. The gallbladder can store up to 50 milliliters of bile. The liver manufactures and secretes bile and bile salts that are necessary to digest fat and fat-soluble vitamins. The liver also synthesizes albumin, fibrinogen, globulins, and clotting factors. The liver is a storage area for glucose in the form of glycogen. It also stores vitamins A, D, E, K, B12, and iron. The liver receives blood directly from the digestive tract via the hepatic portal vein. All nutrients and oral medications pass through the liver before being distributed to other parts of the body. The liver is responsible for how the drugs are metabolized. Preventing disorders of the gallbladder will aid when an individual has a normal body weight. They eat low-fat cholesterol diets. They do not consume excessive amounts of alcohol, and they exercise regularly. The liver plays a major role in the glucose metabolism, removing excess glucose from the blood, converting it to glycogen, and then, as the glucose is needed, it converts the glycogen back to glucose. The liver is a large filter containing phagocytic Kupffer cells that remove bacteria, damaged red blood cells, and other toxic materials from the blood. The liver synthesizes the prothrombin needed for normal blood clotting. The major pancreatic enzymes are amylase, protease, trypsin, and lipase. All of these are essential to the digestion and absorption of nutrients from the small intestine. To prevent attacks, triglycerides should be maintained below 200 milligrams per deciliter. Smoking cessation also decreases the risk of pancreatitis and pancreatic cancer. Autoimmune diseases often affect the GI system, causing inflammation or fibrosis of organs. Treatments like drug and radiation therapy may cause GI problems as a side effect. The patient is often scheduled for a series of tests. Some use a contrast medium. The nurse needs to check the patient's allergies to verify that a particular contrast medium or an injectable marker is not contraindicated. It is also important that GI tests be performed in the correct order so that the contrast media does not interfere with other tests. The patient needs specific instructions about preparing for a diagnostic test. Many of the studies require cleansing of the GI tract. Inadequate bowel preparation may cause a delay or necessitate a repeat of the test. When laxatives are administered in liquid form, the patient can drink them more easily if they are chilled or poured over ice. Perform auscultation before palpation or percussion, because palpation may cause peristaltic movement that otherwise would not have occurred. Bowel sounds are caused by air and fluid moving through the intestinal tract and are heard as soft gurgles and clicks every 5 to 15 seconds. The normal frequency of bowel sounds is approximately 5 to 30 in 1 minute. Anorexia is the absence of appetite. Physical causes for a diminished interest in eating include poorly fitting dentures, stomatitis, decaying teeth, halitosis, and a bad taste in the mouth. Persistent nausea and vomiting will interfere with eating, and it will hinder nutrition. Flatus is known as gas. This is formed by the action of the digestive juices and bacteria on the ingested material and can result in bloating. Constipation is often treated with a suppository or an enema. Can use stool softeners. It is encouraged for the patient to eat adequate amounts of raw vegetables and fruits. They also need to be mobile and walk to help increase peristalsis of the bowel. The liquid form diarrhea is caused with a variety of illnesses like food poisoning, excessive stress, and inflammation of the bowel. Nurses understand that patients taking antibiotics can often develop a bacterial infection with Clostridium difficile, C. diff, that This causes severe diarrhea with a very distinctive odor. With bowel incontinence, it is important that the nurse understands that the patient should maintain a regular toileting regime that helps schedule the bowel movements. Asking the patient how often or how frequently they have a bowel movement will assist the nurse to determine what interventions to use. Defecation is a very personal and private act, even though everyone needs to rid the unnecessary materials from the system. The nurse needs to ensure that the patient feels comfortable and that privacy is obtained, so that way the patient feels at ease whenever they are attempting to have a bowel movement.